In your experience, what are, if, and again, I know the hormones are the thing, but if you could just home in just a bit more on effective strategies for improving sexual health and intimacy for menopausal individuals, particularly
Yes.
when neurological issues are a concern.
Yeah. So, if we could talk about the science all day. Like maintenance of hormones and low dose vaginal hormones is what's going to keep things healthy. But let's not only just think about, because I think about sex from a biopsychosocial approach. Sex is, yes, do I need, again, we're using sports analogies. Um, so what I do is I make sure that your vulva is healthy. I make sure that any disease is gone. So now I'm equipping you with, let's say, tennis. Sex tends to be a team sport. So I'm equipping you with a tennis racket. So now you have your tennis racket, but then someone else has to teach you how to play play
Mm-hmm.
tennis. That's not my job. And
Mm-hmm.
that is actually, I love working in sex and I love working in this field because of how much collaboration and the interdisciplinary work it takes to get people to have good sex. It's not just me. I
Right.
have amazing pelvic floor physical therapists that I work with, sex therapists, sexological body work, all tantra workers. I'm obsessed with this
It's
stuff.
the recipe idea
It's
again,
a
I think.
recipe.
Yeah.
Yes,
Yeah.
yes. It's collaboration. And so yeah, we could talk about the science all day, but actually the best way to have great sex is mentally being there. Your brain is your biggest sex organ. And so one of the things I was really surprised about and seeing talking to my patients, but also in my own sexual health journey, is how much shame
Mm.
we have around the topics of sex and urination and poop. Like all
Yeah.
the things that we're told to don't talk about it, don't talk about it. That is what is literally leading to such bad sex life. Like
Mm.
if you can't even talk about sex and your relationship to sex, and there's so much shame, there's so much trauma around it for so many people, it's going to be so much harder now to then go do it. And again, that sports psychology is like, if you don't believe that you're the best goddamn tennis player in the world, you're sure as shit not going to
Yeah.
want to go up against Serena Williams, right?
Yeah.
Like, so you want,
True.
so
Yes.
you have to be like, no, I am a sexual being. I do enjoy sex. I want to enjoy sex. I want to make sure that my sexual health is as optimized as possible. And that means getting really comfortable with yourself, getting comfortable with your relationship with sex, because sex can look so different for so many different people. And it's just like, what does sex mean to me? And yeah, so that's where I usually
So
start with, of like the mental health of it.